I am having the CO2 laser, which is something I've wanted for a long time, but haven't really had the time to stay at home for a couple weeks afterwards. So this is the perfect time to do it, and I'm excited, but nervous, but mostly excited.
CO2 laser resurfacing is a type of laser that we call ablative. It's one of the stronger lasers that's used to remodel the skin, to resurface the texture, to improve discoloration and help scarring. Patients that have acne scarring need really strong treatments to get improvements, and those that want to have a really strong improvement in one treatment can undergo a CO2 laser resurfacing and then do their maintenance treatments.
So this deeper laser will be able to help build more collagen deeply. The other one's going to do more exfoliation. The combination of this treatment with the next treatment that we're going to do, active effect, is called total effect. We're now doing the second portion of our procedure for acne scars today, which is the fractional CO2 laser resurfacing. He's been nerve blocked and topically numbed, and this laser is working to slough the surface and remodel the superficial textures of the skin. So we're now finishing our laser resurfacing combination treatment. You could see where the deep laser was because it was all the pinpoint bleeding. Now we're putting growth factors and stem cells, PRP, into the skin, and we're pushing it deeper into the skin, 1.5 to 2 millimeters in depth. PRP is drawn from your own blood. This is for post-procedural healing and to help the PRP and the skin get all the nutrients that it needs.
So about 5 weeks ago, I came in for a CO2 laser, and the process was pretty easy, I think, more easy than I was expecting. I didn't feel a lot of pain. I know that might be a little bit unusual, but it was more just the feeling of discomfort afterwards.
So I'm really starting to look back to normal. I'm still really red, and there are like spots where the laser marks show, but I think it's healing pretty quickly now, so I'm doing really well.
During the pain medication really helped. I didn't really feel much pain, and then my downtime was about 2 weeks of not really being able to leave the house at all, and now my results are coming through, so I'm really happy.